Hello all, myself Dr. Vinita Baghela, Women Health Practitioner, Clinical Nutritionist, Antenatal and Garbh Sanskar Coach, Gut Health Advisor, Health and Nutrition Life Coach, welcomes you all on everything about PCOS and PCOD series. आज हम बात करेंगे PCOS और PCOD के बीच का डिफरेंस क्या है. What is the thin line between PCOS and PCOD? So the major difference between PCOS and PCOD is, as the name implies, PCOS stands for Polycystic Ovarian Syndrome and PCOD stands for Polycystic Ovarian Disease. So talking about the first major difference, PCOS is because of endocrine system dysfunction and PCOD is because of hormonal imbalance. The second major point and the main difference between PCOS and PCOD is, in PCOS it is mostly because of genetic predisposition, hormonal imbalance and insulin resistance, whereas PCOD is because of hormonal imbalance, obesity, genetic predisposition, emotional stress and poor dietary habits. The third difference is, if we see in USG or ultrasonography in PCOS, the size of ovaries increase as from the normal size, whereas in PCOD there are small number of cysts that are filled with sac or fluid or follicles that do not increase in size. Fourth difference is the symptoms. In PCOS, the symptoms are hair fall, baldness, irritability, mood swings, emotional eating, whereas in PCOD, the symptoms are increased facial hair growth. We can see the amount of hair growth increase all over the body. There is acne. Then there is also a lot of sleep disturbances which can be seen in such patients. If we see the occurrence, that is another difference between PCOS and PCOD. PCOS is less common in females, whereas PCOD is affected by 1/3 of the female reproductive age across globally. So, if we talk about the severity, PCOS is more severe than PCOD. Why? Because PCOS endocrine system disruption leads to metabolic syndrome, and this metabolic syndrome increase the amount of male hormone secretion more in female body than the female hormones, whereas PCOD is purely because of lifestyle and dietary habits. So once the dietary habits are changed and lifestyle modification is done, it can be cured. And the last difference between PCOS and PCOD in terms of fertility is, in PCOS females are more prone for infertility, whereas in PCOD, in spite of having a history of PCOD, females can conceive. Thank you.